So today we'll be going over Sporo Health's flagship feature of our co-piloting platform, the patient chart review automation. The average physician uses anywhere from 5 to 10 minutes per 15-minute patient visit on doing patient chart review, puzzle piecing the patient's health history from hundreds of pages of patient records. It's a pivotal part for the patient-physician relationship, disease burden management, and forming the correct differentials. And Sporo Health is proud to be the first healthcare AI research lab to be presenting such a core feature for clinicians around the country. So let's define the problem first. Raise your hand if this sentence applies to you. There's a significant time sink caused by patient chart reviewing, which leads to revenue loss, burnout, and poor patient outcomes. If you've raised your hand, then the following is an extremely familiar, typical view that you as a clinician may see. Having to go through the plethora of unstructured information from all corners of your EHR. It causes severe stress, and this can lead to poor quality of care delivery, especially if not enough information is collected or even wrong interpretations occur. And so what is our solution? Make way for Sporo Synopsis. We turned the headache of digging through EHRs into a digestible, interactive summary for all physicians to easily access. And how does it work? Well, we take the various information from all corners of your EHR using the EHR's open API and integrate it all, first going through a de-identifying platform through our security, and finally going through our first of its kind, a pioneering multi-AI agentic workflow, and create digestible summaries just for you. But we don't stop there. Your feedback can also be directly integrated back into Sporo AI's agents and help them learn off of your style of care, ensuring that your experience is as tailored to your needs as possible, streamlining your workflow to its limits. Now keep in mind, the physical representation of this slide may make it seem like the unstructured data is a small portion, but this is the real value of our Sporo Synopsis feature. Anyone can summarize structured EHR stuff, but only Sporo can truly read the thousands of pages of clinical notes for each patient within seconds and create a comprehensive summary experience that gives clinicians exactly what they need to treat their patient. So why choose us? Well, there are many reasons. First, our multimodal AI agents incorporate diverse sources of information that other alternatives may miss. We're highly customizable. Our AI agents learn off of your needs and your style of practice to tailor itself using your feedback. We're friendly towards any type of data source, including any type of data file formats. We have HIPAA de-identifiers removed through Sporo's de-identification framework because we prioritize data privacy and patient consent. And unlike other LLM tools, Sporo utilizes multiple AI agents to collaborate on automation tasks, which increase accuracy and reduce risks of bias. We also include a chatbot assistant that makes gathering information from EHRs conversational, easy, and interactive. And most of all, we're a dedicated team that offers 24/7 support for problems, feedback integrations, and communications. So now that we got that out of the way, let's try a couple demos. So here we have the landing page for Sporo Synopsis. Keep in mind, this is a demo. What it will most likely look like is a pop-up that comes up in your browser or EHR that looks like this. But for demo purposes and making sure that we hide the best surprises for when you join us, we will be utilizing this demo platform for today. We have this feature hooked up to an EHR with patient information. I will now choose a patient and press Generate Synopsis. Now, if I wanted to tailor this synopsis towards a specific subject, such as a patient's stroke history, I can go into Chief Complaints for further tailoring. But for now, I just want a general summary, so I'll just click Generate Summary. And in a few seconds, we have a complete synopsis, complete with all sorts of information that you will need, including PMH, family history, any relevant HPI, etc., etc. And what I also want to direct your attention to is that we also have a chatbot, which is reminiscent of our co-piloting philosophy platform that you can ask questions to, such as, what medications is this patient taking? And Sporo will return the answer to you in seconds, making information collection easy, conversational, and interactive. I also want to point out that you can also edit these summaries, like so, to teach Sporo which information you'd like to see more of, less of, which styles, and even customizing it with your own templates. Let's see another example with comprehensive patient example. So if you're familiar with my video series, you already know of my fictitious but lovely patient, Tracy Femur, and how SporoScribe helps me maintain my relationship with her and ensure the best care quality, making sure to capture all of her information from my conversations with her in summaries and easy, efficient ways. Here I have many different charts from her EHR, including some conversations that SporoScribe had summarized for me into medical notes, some notes I've written myself for other visits. I think there's like at least 8 notes in this document alone. Multiple oncology consults from specialists. Here's one here. There's another one down here. As well as chest x-rays, CTs, MRIs, whole body PET scans, multiple labs including the complete blood count panel, blood chemistry panel, cancer biomarker panel. There's even a biopsy in here, and even a prescriptions list and allergies as well. That was a mouthful. Now, I had Sporo Synopsis run this for me for my upcoming progress visit from Tracy to see how she's doing with all of this information and the results of what oncology says her treatment regimen should be for her primary adenocarcinoma. So let's see how Sporo Synopsis is going to help me. I inputted a template for Sporo Synopsis to follow, and this is what it returns. So here I asked her for her information, her chief complaints, her HPI, her past medical history, her past surgical histories, her medications and allergies. This looks all good. Her social history as well. Oh, I completely forgot that she was a former smoker, so it makes sense that her primary adenocarcinoma in her lungs makes sense to me now. Family history, her review of systems. Oh, I completely forgot. She had mentioned that her paternal grandfather had lung cancer at 54. Who would have known? There's also her physical exam, and it summarizes all of her lab data, including her radiology interpretations, and it even gives me a 2-liner about her health history as well as her recent diagnosis of, what do you know, primary pulmonary adenocarcinoma stage 1. And she's scheduled for surgical resection and oncology referral for further management. Great. So as you can see, this is a really powerful tool that summarized literally 32 pages of her records just on her oncology clinical course alone. There's potentially hundreds of pages associated with Tracy's health history, but for now, it took these 32 pages, and it took me literal seconds to generate this note. And now I only take 30 seconds to take a look at this, instead of the 1 hour it would have taken me to read through 32 pages of her records. And if this is something that you'd like to have integrated into your practice, you should reach out to Sporo Health today and join our journey.